Today we're going to talk about the post-operative drains that you see after face and neck surgery. These are called JP drains in the healthcare world. It's a fine little tube that goes all the way up to your dressing. Now past here, that's in another video, but there's a little stitch that holds it in place. But after surgery, we want you to do this process called stripping the drains. Stripping means that we don't want any of this blood to clot in the tubing, because then the tubing wouldn't be as effective. The easiest way to do this is if you take a little alcohol wipe, and we'll try and always give you some of these before you leave, but we'll take a little alcohol wipe, and then that makes your fingers kind of slippery. But what you want to do is you want to stabilize the drain with one hand. So I'm stabilizing it here with my right hand, and then running the tubing through my pinched thumb and index finger the whole way down. And you can see that it kind of breaks up the little bit of blood that's in the tubing. Now the tubing is designed not to allow blood to clot. That's how it's kind of biologically designed. But when you strip the drain, then you get a little bit of fluid down into these little reservoirs. In healthcare, sometimes we use a slang expression. We call these the grenades. They look kind of like grenades from old movies. So you pop the top on that, and you can see that now the reservoir is open, but if you squeeze it with your whole hand, get all the air out of it, and then you cap it, because it's capped now and you've squeezed all the air out of it, the rubber nature of the drain, it wants to re-expand, and that's what creates the suction. So you want to empty your drains about every 8 hours, and then strip the entire length of the tubing probably every couple hours the first night after surgery, and then maybe every 4 to 6 hours on the second day. But for the first night, every couple hours.
Okay, so you're going to take your bulb and you're going to uncap it to drain it. You're going to squeeze it into a cup or the toilet or sink, whatever is easier for you. And then once you've done that, you're going to make sure you squeeze all the air out of the bulb and put the cap back on so that it stays sealed like that all the time. So it should be nice and flat, just like that.